Of all committees in Congress, only one has the authority and the responsibility to speak directly for America's farmers, ranchers, and food producers. It is this committee. We are the committee farmers turn to when markets fail, when costs rise, and when federal policy threatens their ability to stay in business. The jurisdiction entrusted to us is not ceremonial. It carries responsibility. Because when farmers are hurting, the obligation to fight for relief falls here with us. And right now, farmers across this country are hurting. No matter what they grow, row crops, specialty crops, livestock, or the food products that feed American families, they share one common experience over the past year: tariffs. An $8 billion tax on the people who grow the food, fuel, and fiber on which this country runs. They didn't write these policies. They didn't start a trade war, but they are paying for it every single day. Seed costs more, fertilizer costs more, equipment costs more, fuel costs more. Margins that were already thin are disappearing. Preliminary estimates show tariffs on essential agriculture inputs alone cost producers more than $8 billion in 2025. Farmers don't need a study to tell you what that means. They already know. These tariffs are a tax on American agriculture. And while the Supreme Court invalidated the Liberation Day tariffs, the administration's push for sweeping global tariffs means producers continue to face costs they simply cannot afford. So the question before us is straightforward. If the Agriculture Committee is not the place to address the economic survival of farmers, then where is it? Some may say tariffs are not traditionally part of a farm bill, but the Farm Bill exists to stabilize agriculture and protect producers from forces beyond their control. When federal policy directly raises the cost of producing food, that becomes an agricultural issue. Farmers don't sit on trade committees. They don't negotiate tariff schedules. Their voice in this debate is us. And we should lean into that responsibility, not avoid it. This amendment is simple. It removes farm inputs from tariffs, not to rewrite trade policy, but to stop taxing the very producers we claim to support. Farmers are not asking for handouts. They're asking the government to stop making their job harder. A bipartisan group of agriculture leaders recently warned this committee that indiscriminate tariffs are driving up input costs and threatening farm stability nationwide. Their first recommendation was clear: exempt farm inputs from tariffs. That is exactly what this amendment does. And the consequences reach far beyond the farm gate. When farmers pay more, families pay more. Higher production costs become higher food prices. Every day we delay action is another day those costs ripple through the food system. The Farm Bill has always succeeded because this committee accepted its responsibility to stand up for agriculture when it mattered most. This is one of the moments. We cannot claim to support farmers while ignoring an $8 billion tax pushing them closer to the edge. Our farmers need a voice. Our ranchers need advocates. And that responsibility rests with us. So let's use the authority this committee was given. Let's deliver real relief, and let's stand with the people who make and grow things right here at home. Our farmers, our ranchers, our food producers, they deserve to see where we all stand right now with a vote on this amendment. I urge adoption of the amendment. Thank you, Mr. Chair. I yield back. I speak in strong support of this amendment. We've heard not once but twice before this committee that if states are forced to endure these increased cost shares, there are those states facing literally hundreds of millions of dollars in additional costs annually that will simply choose not to do the program. Not funding the EBT SNAP program means that pregnant women, senior citizens, families with young children under the age of 15, our veterans, the working poor, will simply have no money on their cards, no money at all. For too many states, the ask to fund an additional $100 million, let alone hundreds of millions of dollars, is an impossible choice. They can't pick off schools. They can't pick off health care. They can't pick off improvements to roadways, security, safety, law enforcement. We have heard from expert witnesses sitting right there at that table, and again, not once but twice, say there are those states, there are those counties and jurisdictions that will simply choose not to participate in the program because they can no longer afford the cost share that the big ugly bill has instituted on them. And so this simple ask to delay these additional cost shares that will place impossible burdens on our states and our counties. This is a good amendment that must be passed for the sake of making sure those pregnant women everyone's so concerned about, those senior citizens that everyone's so concerned about, those families with children under the age of 15 are so concerned about, and for the rest of us, all those other normal people that are working hard but still can't afford to eat, we need to make sure that we pass this amendment for them. Thank you, and I yield back. Last year, the administration eliminated $660 million in local food for schools funding. That's 42 benefits throughout the country that benefited from these funds. Secretary Rollins said it wasn't in alignment with department priorities. Feeding children fresh food grown by American farmers, helping schools buy directly from local producers, making sure kids have healthy meals on their trays, providing a $660 million guaranteed market for American farmers. If this isn't a priority of the USDA, we should be asking ourselves, why not? On the USDA website, it specifically states we have a vision to promote agriculture production that better nourishes Americans. Call me crazy, but this sure sounds like it's in alignment. What this really was about, though, was taking locally grown food out of the mouths of children to feed more tax breaks for billionaires who've already gotten fat off of our tax dollars. That is the truth behind these cuts. Because these weren't abstract dollars on a spreadsheet. They were real contracts, real crops, real expectations. Farmers planted fields believing there would be markets. Small producers invested in certifications and infrastructures. Schools built procurement plans around serving fresher, healthier meals. For millions of kids, school lunch isn't optional. For many, it may be the only meal that they get that day. The local Food for Schools program made sure school meals were healthier while driving dollars back into rural economies, strengthening small farms, and keeping food supply chains rooted in their communities. Programs like Local Food for Schools are rare in government because they work on every level. Local farmers and ranchers need stable markets. Hungry children need nutritious foods. Putting those two needs together strengthens rural economies, shortens supply chains, improves public health, and encourages and introduces young Americans to the value of locally grown food, creating the next generation of consumers who will sustain American agriculture. That's not waste, that's not misalignment, that's smart policy. And for anyone questioning whether this amendment is germane to the Farm Bill or this committee's jurisdiction, the answer is quite simple. This program is funded through the Commodity Credit Corporation, an entity directly under the authority of the Secretary of Agriculture, the very department overseen by this committee. Secretary Rollins was the one who made the determination to cut this funding. Schools and child care centers are merely the distribution point. This is, in fact, an agriculture program, food from our farmers, which means the responsibility to restore these cuts belongs to us. We cannot claim to stand for farmers while eliminating their markets. We cannot claim to care about nutrition while cutting programs that put fresh food in front of children. And we cannot claim to make America healthy again while dismantling one of the most effective farm-to-table programs this country has ever implemented. My amendment is straightforward. It restores the funding that was terminated by the USDA. It honors commitments made to farmers. It gives schools and child care centers certainty, and most importantly, it ensures that our kids eat. We can disagree passionately, as we have all day today, on many amendments before this committee. That's part of the process, but this should not be one of those fights, because at its core, this is about something bigger than politics. It's about whether we can come together around a simple idea. American farmers should be the ones feeding American kids. Canceling these cuts means farmers sell what they produce. Canceling these cuts means communities grow stronger. And canceling these cuts mean our children are able to eat. I strongly urge my colleagues on both sides of this aisle to support this amendment. Thank you, Mr. Chair, and I yield back. I rise in support of Ms. Pingree's amendment and in strong opposition to the reckless provisions buried in this bill. I understand that our farmers and agriculture producers need access to effective tools for pest management. Farmers deserve certainty, workable regulations, and science-based policy. But this bill is not the way to provide that certainty. Stripping states and communities of their authority and weakening bedrock environmental protections is not balance, it's overreach. Furthermore, one-size-fits-all approach to pesticide labeling cannot fully account for the realities in my home state of Hawaii. We have year-round growing seasons, endangered species found nowhere else on Earth, unique geology and topography, communities living and going to school right next to agriculture fields, and watersheds where everything flows directly into the ocean, from the mountain to the ocean, Mauka to Makai, and watersheds where everything flows, as I've said, directly into the ocean. Our circumstances and our experiences are unique, and our policies must have the ability to reflect that. Mr. Chair, share a story I think you could appreciate in terms of the uniqueness, but also the experiences that we've had. You know, in 1982, I remember as an elementary school student drinking chocolate milk every day at school during lunch, and I thought it was great. But the darker story behind it was that we had to import chocolate milk in because we had to dispose of 36 million pounds of milk because it was found to be contaminated with the pesticide heptachlor. The cows were fed the tops of pineapples that had been sprayed with a now banned insecticide that's linked to higher rates of Parkinson's. And so when we talk about the impacts of pesticides, Hawaii literally has a history of this going back generations. Hiding or preempting action on dangerous information about pesticides does not make our communities safer, and we've seen that. It endangers everyone, and especially workers, pregnant women, our keiki, our kupuna, vulnerable communities who are often on the front lines of exposure. We can support farmers while respecting state and local authority to make decisions in the best interests of their people and upholding bedrock environmental protections. Those goals are not mutually exclusive. We do not have to choose between agriculture productivity and public health. I strongly urge my colleagues to stand with our communities and our farmers and our futures and support this amendment. Thank you, Mr. Chair, and I yield back. Last year, the Big Ugly Bill made a $500 billion cut to Medicare and a $1 trillion cut to Medicaid. Medicare and Medicaid are lifelines for rural America. In rural communities, these programs represent, on average, 50% of a hospital's payer mix, and nearly half of all rural hospitals are already operating on negative margins. These are cuts rural hospitals across the country simply cannot absorb. 200 rural hospitals have closed over the last 20 years. 400 rural hospitals are at risk of closure, service reduction, or conversion because of the Big Ugly Bill's cuts. That includes 6 hospitals in Hawaii, in my district alone. Some of these are the only hospitals on their island. Some are the only hospital within a 50-mile radius. For rural communities in Hawaii and across this country, closure would not be an inconvenience. It would be a death sentence. The Big Ugly Bill is projected to cause a 21% decline in Medicaid reimbursements for rural hospitals. You cannot cut a fifth of a rural hospital's Medicaid revenue and expect business as usual. Medicaid covers nearly 1 in 5 rural adults and 40% of rural children. When you cut Medicaid, you cut coverage for a significant share of a rural hospital's patient base. Changes to provider taxes and state-directed payments further reduce funding flows to our rural facilities. New work reporting requirements and frequent eligibility checks will push eligible rural patients off coverage because of paperwork, barriers, and especially in areas with limited broadband access, people just can't apply. Fewer covered patients mean lower patient volume, higher acuity rates, more uncompensated care, and immediate revenue losses. And when revenue drops, staffing costs still remain fixed, as we know, which means hospitals are forced to choose. Do they cut the workforce or do they cut services? And these services and staffing reductions are not hypothetical situations. They are literally happening right now in our communities. Now, I've heard a lot of hype surrounding the $50 billion Rural Health Transformation Fund, but this money falls far short of the projected Medicaid losses that rural hospitals will face. This transformation funding should have been additive, helping rural systems innovate and modernize. Instead, rural hospitals are being forced to figure out how to backfill massive revenue cuts while fighting for such scraps. Time and again, all rural providers have ever asked of Congress is simply helping them to keep the lights on, help keep doctors and nurses on shift, help keep emergency rooms open. And while I'd like to say we should cancel all these cuts, I agree that would not be germane to this bill. But that is why I'm offering the amendment that I am today. My amendment would authorize funding within the USDA's Community Facilities Program to reimburse rural hospitals for revenue losses caused by temporary reduction in patient volume or service delivery. It also allows funds to support staffing costs necessary to maintain essential services, recruitment, retention, and workforce stability. My amendment ensures providers have actual bridge funding when coverage losses and reimbursement cuts triggered by H.R. 1 create sudden revenue shocks by opening up targeted, responsible financing tools within the USDA to stabilize these facilities that are in immediate danger of closing. And this amendment dedicates funding without taking away from existing community facilities priorities. This is practical, this is responsive, this is what rural providers are asking for right now. Not transformation grants, not theoretical redesigns, not shiny new pilot programs, stability, support, just some breathing room. If Congress is going to slash rural hospital revenue, then we also have a responsibility to help them stay open. That should be the actual baseline for transforming rural health care. My amendment is a step in that direction, because once a rural hospital closes, we know it rarely reopens. And for communities that rely on a single facility for emergency care, maternal care, and basic inpatient services, time is of the essence. Waiting is simply not an option. I strongly urge my colleagues to join me on both sides of the aisle to support this amendment. Thank you, Mr. Chair, and I yield back.